Hi, my name is Amit Jain. I'm a pediatric and adult spine surgeon at Johns Hopkins, and today we'll be talking about Schroth method and Schroth therapy for scoliosis. Schroth is a technique that was developed in order to help elongate the spine, derotate the spine, and help improve scoliosis. Schroth exercises are specifically designed based on the individual's specific curve pattern. These exercises are best determined by a physical therapist who is trained in the Schroth method, and they can help train the patient and teach the patient how to best participate so that the spine can untwist and reach some correction. The results from a Schroth program are variable. It really depends on the patient's curvature, patient's growth remaining, and how motivated the child is and what additional aids are being used. So for example, if a child has a pretty relatively low curve, the Schroth method can be very effective because it can help keep the scoliosis from progressing. If the curvature is in the braceable range, Schroth can be a great adjunct to bracing to prevent the progression into a surgical range. However, if a child is already in a surgical range, the Schroth method can help with flexibility but may not necessarily help with curve correction. So one of the frequently asked questions we get is Schroth going to help me from stop needing surgery? And I think it's important to recognize that every child's curve and their curve pattern is unique and their growth remaining is unique. So as a result, some children are going to go and progress in their curvature and may require surgery. The Schroth can help maintain flexibility, but it won't necessarily stop that progression. In a lot of other cases, when the curvature is smaller, the Schroth can certainly be very helpful and help improve the curvature to some degree. But if a child is going to be progressive, it's probably not going to stop that from happening. Another question we get frequently asked is, where can I find a Schroth therapist? Schroth therapy is a very specific art form, and certain physical therapists go and achieve a special certification in this method. It's important to recognize and identify someone at your local institution or someone in your city who may be trained in this. At Johns Hopkins, we have a dedicated group of therapists who have trained in the Schroth method, and that's a great asset for us. Another frequently asked question is, can I stop wearing my brace if I do the Schroth method? And the answer is no. Bracing is a very important step in management and treatment of scoliosis. And it's really important to wear your brace if your surgeon decides that bracing is the right option for you, because there are studies that show that the longer you wear your brace, the more likely you're going to help prevent progression of the curvature. However, Schroth can certainly help maintain the flexibility, so it can be a great adjunct but does not replace bracing.